स्टार्ट करूं? अरे अरे मैं तो काम किया था रिकॉर्डिंग किया था
ऐसे तो है नहीं अब कुछ खुद को होगा पॉजिटिव बात हुई और तो वो माइल्ड वायरस
very good morning to all. Today I'm going to present interpersonal therapy. Presenter myself and moderator Dr. Mandani sir, associate professor. Introduction. Before introduce interpersonal therapy, in 1980s, during the treatment of antidepressants, tricyclic antidepressants, there is a need for counseling and therapy aspects for interpersonal issues. So that time, interpersonal therapy was originally developed by Clermont et al. Treatment with adolescents in major depression. After that, it is a short. It is also called as short-term attached placement psychotherapy, which aims to alleviate patient suffering and improve their current interpersonal functioning. And also, IPT focuses symptomatic recovery, learn to ask more emotional, practical, social support they need. IPT, interpersonal therapy, observing the social, biological, and medical antecedents of clinical depression. Interpersonal therapy also observing the socio-biological and medical antecedents of clinical depression, diagnosed through the use of medical models. Interpersonal therapy outline during the first phase. Actually, before doing interpersonal therapy, there is a need to assess interpersonal deficits in the family members, and is there any secured family history of depression in the family, or patient has any issues with the hypertension patient in the family, and the patient has any family issues in the with the family members in the family. After that, we need to do in the first phase in the before starting the interpersonal therapy, we need to do psychoeducation with the patient, and after that, diagnostic evaluation we need to do as per ICD-10, DSM-5, 11, and aspect. And after interpersonal inventory will be followed by assessed, and after that we identify the major interpersonal issues and explain the IPT approach and make a treatment contract with the patient. During the intermediate sessions, this session has been followed by 4 to 8 sessions. During this intermediate phase, we need to do with prominent problem areas of like grief, role transition, interpersonal role disputes, and interpersonal deficits. I will explain detailing in further slides. Attending to the patient's affective state and in the therapeutic relationship, and we need to do like reflective listening to maximize the patient intimate self-disclosure and preventing the patient from subjugating the treatment. In the termination phase, 9 to 12 session has been followed with the patient. Here we expect discussion end of the treatment, and with the patient, we need to do their own aspect, own ideas, own plan in the future. Grief. What is grief? Grief is considered a problem area when the onset of the patient's symptoms are associated with a death, either present or past. There is two types of grief: normal grief, abnormal grief, and other classes are considered as role transition. Normal grief, there is a process of normal grief includes a full awareness of the reality of the death.
What is that? In context of what? has a problem with it.
Yes, sir.
Five problem because that you defined earlier.
Yes, sir.
Even issues like yeah, grief, role transition, interpersonal dispute, interpersonal dispute. Okay, so this only you are expecting.
Yes,
To tell other people, otherwise they'll be confused.
Yes, sir. In the normal grief, person also has some slightly depressive symptoms like sadness, disturbed sleep, agitation, decreased ability to carry out day-to-day activities at least 2 to 4 months. Due to this normal grief, the person should not have need for any psychiatric treatment, and also it is not considered psychiatric disorder. Abnormal grief reaction may be diagnosed when grief is severe, protracted, and interferes with the resumption of functioning when the patient has been unable to grieve appropriately following the death of a loved one. There is a two types of abnormal grief, like a delayed grief and distorted grief. Delayed grief, the grief is postponed and experienced long after the loss. Initially, the person is not accepting the deceased one and our situation, and when grieving occurs, it may not be recognized as a reaction to the original loss, but the symptoms are those of normal grieving. Questioning the grieving person about earlier losses will show that this person is actually mourning the prior loss. Distorted grief may occur immediately following the loss or years afterward. There may be no sadness or dysphoric mood in the distorted grief, and instead, apparently non-affective symptoms may be present. Other patients grieve interminably, unable to end their mourning and return to their normal life flow. Abnormal grief treatment. There is two goals of the treatment for depression, to facilitate the delayed mourning process and to help the patient to re-establish interest and the relationship that can substitute for what has been lost during the grief aspect. Initially, we need to psychoeducate the patient in the treatment aspect of abnormal grief and encourage the patient during psychotherapy, as well as listen. Reflective listening is needed for here, and explain the loss to discuss the sequence and consequences of events like prior, during, after the death, to explore the associated feelings. A model of like understanding the problem, listening the problem, method of understanding and listening, and a reassurance. The reassurance aspect helps to anticipate the patients, like further complaints and thoughts, reconstruction of relationship, like formation of the what are the loss in the previously during the relationship issue. We need to rearrange them in the sessions during the treatment of abnormal grief. And catharsis, we need to ventilate the patient's emotions, negative emotions. What are the negative emotions they have? What are negative thoughts they had? And behavioral change, it helps to patients to recover from isolation. Interpersonal role disputes, example, the husband wife thinks that our financial issues solved by husband, but husband also during the depressive episode he thinks that this month my wife will be solved by our financial issues for the month. During the communication, there is a different expectation from the others in the family members or couple. Due to husband depressive symptoms like loss of self-esteem, loss of interest while performing family roles, it results conflict and non-reciprocal nature and family disputes. Treatment for interpersonal role disputes, like determining stages, like impasse, like a conflict between the patient and one more relatives. For the treatment, to help the patient to recognize their complex mixed feelings of anger, sadness, and device strategies, let him to use avoiding situation which they arise, help them to reduce impulsive behavior. Renegotiation, like implies the patient and the significant other are openly aware of differences and are actively trying, even if unsuccessfully, to bring about changes. For denunciation areas, for treatment to help the patients to learn new ways of communication and self-assertive behaviors, and in order to facilitate the resolution of dispute. Family dissolution implies that the relationship is uh, irretrievably disrupted. For treatment as well, we need to help the patient to put the relationship in the perspective and become free to form new attachments. In everybody in our life, we had a lot of role transitions, like a student, wife, mother, new employee, etc. But there is a rapid adaptation of roles. Example: divorce, loss of leisure, birth of a child, retirement, moving, changing jobs, leaving home, economical changes. It gives us biological and psychological development aspect. And if we had failure in the role transition, results in depression, and depressive patients feels hopeless to change their role. So these role transitions associated with the following issues like loss of social support, management of accompanying emotions such as anger or fear, demands of new repertoire of social skills, diminished self-esteem. Treatment for role transitions like giving up old role, what are the issues they had, we need to take them to the old situation, and we need to understand them to discover grief positive aspects while difficulties with the old role, and acquiring new skills. We need to educate the coping skills to the patient. Like such skills might include finding an important like one's own and learning to get around in a community, finding a new job, and learning to entertain. Establishing social support. Previously, depressive patients, there is a might be they had like a lack of social support. There is no friends. There is no relationship with them. So we need to help the patients to attain a new relationship with the new people, discuss positive aspects of new role, new social support and opportunities. Interpersonal deficits. Interpersonal deficits are chosen as the focus of treatment when a patient with major depression presents with a history of social impoverishment, inadequate or unsustaining interpersonal relationship. Interpersonal relationship will be happen inside of the family members, like a family of creation, like creation areas, family of uh, procreation areas, or family of orientation areas. So we need to who is the stressor of the family members, who always making the patient to relapse the reversing the symptoms. So it is important to rule out dystemic disorder also among patients with interpersonal deficits, and chronic depression often presents with social impoverishment, chronic low self-esteem, and seemingly characterological features. In treatment aspects, we need to view the what are the interpersonal disputes they had in the past, and including negative or positive aspects. We need to explore the feelings whatever they had previously during the relationship issues, and the discussion with the patient with the aspect of negative and positive feelings. We need to educate what is the negative feelings, what is the positive feeling, and we need to educate the patient to how to create again, form again the relationship with the family to recover the interpersonal deficits in the family. These are the behavior change techniques, like directive techniques. Apart from the four areas like grief, interpersonal disputes, interpersonal deficits, and behavior change techniques is normally we used to do in the counseling aspect also, like directive techniques. Like directive techniques include interventions such as educating, advising, modeling, or directly helping the patient to solve relatively simple practical problems. Advice and suggestions should be provided only when the therapist thinks the patient is unable to make a relatively successful decision on his or her own. Direct help should be used exclusively for solving practical issues. So here, the interpersonal therapy, the therapist is a facilitator. So we need to listen, we need to explore the patient's feelings and problems here. And during the directive techniques, we help to excluding the practical issues also. Disease analysis, this is a technique by which the patient is helped to consider a wide range of alternative actions like that can be taken to solve a given problem. Here we help the patients to recognize broadening range of options. Role playing by doing some 2 minutes like a kind of role playing aspects like psychodrama aspects. We need to educate the patients how to recover the past relationship issues, how to recover the negative emotions to positive emotions with the aspect of role playing. Indications for long-term treatment. Few patients need a long-term treatment in IPT, interpersonal therapy. Example, those who have personality issues and those who can initiate relationship but not sustain them. Recurrence depression who require to prevent relapse. Those who are not responded and are still acutely depressed. A long-term treatment should be referred elsewhere or should make a new and different content involving a change in focus and techniques with the same therapist. We can see a lot of problems in IPT, especially patients' self-feelings, like patient feeling that I'm having chronic issues, patient feeling that depression is incurable, patient feeling that fears being alone, patient feels that fears of loss of control, patient has difficulty accepting his or her wishes, patient avoids positive experience, patient takes the blame for family or group problems, patient sees treatment as a defeat, patient attempts suicide. And the problem is the therapy aspect, like patient substitutes the psychotherapist for friends or family. Patient taken not a family members, taking the substitute to the therapy, and the patient misses appointments or it is late. The patient is silent. The patient changes or avoids subjects. Patient is subjugating treatment. The psychotherapist develops powerful feelings toward the patient. Patient more than the patient capacity. And the common patient concerns like patient feels that do I have a biological depression? Can I give depression to my children? Can I drink my blues away? So there are studies also done regarding to the IPT aspect. Very famous study, Boston New Haven study done by D. Masico et al. In the year of 1979. This is the first efficacy of interpersonal treatment with antidepressants with 81 outpatients with amitriptyline was dosed under to 200 milligram. Amitriptyline and IPT is more effective than monotherapy. On the other hand, interpersonal therapy and amitriptyline seem to work preferentially on different symptom clusters. Medication had its initial effect on the neurovegetative symptoms of depression, whereas interpersonal therapy worked mainly on mood, apathy, suicidal ideation, worked on interest. According to Weisman et al. In the year of 1981, patients who received interpersonal therapy developed significantly better psychosocial functioning over the course of the year, whether or not they received medication. In the Dutch studies, they say that it has been done by Netherlands. Interpersonal therapy effect an open trial for patients with mood disorders. Based on this study, like Hornkamp and colleagues done by other studies, like undertaking randomized study with the 200 patients, comparing interpersonal therapy alone with the nephosodone, their combination, the interpersonal therapy placebo for acute work for acute major depression. Neuroimaging, Martin and colleagues at the University of Durham in the United Kingdom report their use of neuroimaging with antidepressant treatment works well. And they treated 28 patients with DSM-4 criteria.
are they relevant to your, for example, your strategy are useful. So how are they relevant to your topic?
So it has been, this is a separate chapter for interpersonal therapy books they given, sir. So that
Okay, you should only do those where the interpersonal in the talk itself, you don't need to put the whole chapter.
okay, sir.
Just summarize the just 1-2 lines, just summarize what is the study. You need to say that they are effective, right?
Yes, sir. Here, subject were assessed using SPECT imaging. The results also showed that there is a significant angular gyrus and dorsolateral prefrontal cortical normalization, whereas intervention therapy patients showed dorsolateral prefrontal cortical normalization and limbic central cingulate normalization. The paper has been published by the famous author like Markovitz et al. The year of 1996. Dysthymic individuals during paper titled like psychotherapy for dysthymic disorder. This is a Markovitz has been studied with the dysthymic patients during that time. The dysthymic individuals frequently use mental services, many visiting non-psychiatrists and who cannot prescribe medications. During the study, interpersonal approaches with dysthymic disorder suggested to treat interpersonal difficulties. There are changes in dysthymia to euthymia. Another observation: pessimism to optimism after regulatory supervised and monitored treatment adherence. There is another study done by Christopher G. Fairbairn et al. Paper titled Psychotherapy and Bulimia and Anorexia. This is a long-term effects of interpersonal therapy, behavior therapy, and cognitive therapy, cognitive behavior therapy treatment done with bulimia and anorexia patients. After interpersonal therapy, the therapists we observed repeated instances of patients making major positive changes in their relationships. Often this setting train other positive changes, many of which were still evolving at the end of treatment. A pilot study done with post-traumatic stress disorder patients. During everyone knows that September 11 in the year of 2001, there is a terrorist attack, increased interest in treatment for PTSD in USA. Interpersonal psychotherapy is a life event-based treatment, and also PTSD is a life event-based disorder. Due to this pilot study, interpersonal psychotherapy showed excellent retention and high response and high remission rates. It is improved interpersonal functioning and symptom relief may motivate patients self-exposure to further master their trauma. These are my references, sir. This is interpersonal inventory. These are the questions we need to. Yes,
what is this inventory used for?
So to assess like basic depressive symptoms, grief, interpersonal dispute. Yes, sir. Yes, sir.
First,
grief.
So first is how do you do diagnostic evaluation? That is you complete the IP. So
Yes, sir.
after the inventory,
Patient, how much they scored. After that, what are the areas they have been dysfunctional?
basically you identify the areas.
Yes, sir.
Okay. The outcomes. From the inventory and interview, you are able to assess that these are the areas that are basically. Then you, as I have in the 4 areas, there are specific interventions for those areas and you carry out. The next slide, grief. So grief can say how interpersonal therapy grief can affect. Can you give examples?
Sir, in depressive patients, almost they have factors of like biological and social antecedents. Due to that, there will be they may have precipitating and perpetuating factors of deceased one.
How it is described, it can affect the person who is grieving.
Sir, this grief aspect is only for depressive aspect, sir. There is a separate grief therapy. It is also applicable to the normal medical disorders such as cancer,
So this is
AIDS.
not we are not talking about say grief in other situations.
Yes.
Okay, but where a person is like is not able to overcome the loss.
Yes.
Okay. The loss may be like the person passing, but it can even be like a person moving away.
Yes.
For example, say a husband transferred somewhere else.
Yes, sir.
Okay,
Yes.
that may trigger an abnormal, you can say, grief response from the past experience. Like the
Yes.
husband has gone away.
Yes, sir.
That affects their relationships. Also, the person may become depressed.
Yes, sir.
Okay,
Yes.
so it is not just like you say delayed grief. So postponed experience is long after the loss. It is not after just grief, is just after the death.
Yes.
Like 4, 5, 10 years after that, and say something happens and it triggers that experience.
Yes, sir.
Okay. So this is that postponed experience is long after the loss. Okay. And it can occur immediately after, like distorted grief.
Yes.
Here the problem is that other people have moved on, the person is still
Yes,
in
sir.
that area, and then there is a problem. Like the people in that relationship, they find it difficult to cope with that person because he's still in that process, and that there is a conflict.
Yes.
The person grieving sees that they are not understanding, I am in loss, and the other person sees that this patient is not moving on with life. He's still grieving, so creating problem for him. That conflict and then result in depressive. Okay. Right? Yes, JR3, you studied this special slide, karo. Now, okay. Tanya, can you say from your patient, tell that it's a previous slide. Can you tell any patients where you are now able to think that they had problems in these areas? Injury, transitional, interpersonal disputes, interpersonal deficits. Okay. What? Yeah. Role transition का कोई example दे सकते हो? क्या होता है role transition? क्या हो सकता है? You are intern. Join किया है. These are office space.
Sir, I have seen one patient, Taljit Singh. His father should not accept his patient's illness. His son is नाटक कर रहा है, फाइटिंग कर रहा है, बार-बार बोलता है, बहुत गुस्सा होता है.
Like becoming sick, but basically like student going to college, wife getting a job. Okay, now she's not able to pay so much attention. Still need to change. Yes. School change. So other change the area to Liverpool, and suddenly not able to just to extramarital effects. So what if someone comes to you having an extramarital affair? Some conflict has come into my life. My husband might know about it. What do you?
Sir, as per interpersonal inventory, after assessment of interpersonal inventory.
There is an interpersonal deficit.
Yes, sir.
There.
Yes, sir. Then with the patient, I will help them to like help the treatment as well with this one as well I will apply to the patient, sir. Like explore the feelings of the past events and what are the frequent in between frequent quarrel, how they had a conversation between with the wife and husband, how they had.
It's all there. It's all there in the format. To look in the treatment part, it is all there.
Yes,
Okay, so what you have to do? Structured therapies are good because you can take help of that. Okay. And the final here you can see this is that you try impulse renegotiation and then is resolution. Okay, like if they have come to a conflict where the spouse, they have tried everything, they are trying for, and then they are still, in a side of relationship where they are continuing not together, then resolution, like you can see is that we have tried everything. Or if say that one of the things is if the spouse is physically violent, okay, abuse, if the patient is facing abuse, chronic abuse, okay, you can suggest that you see this is non-negotiable. Like you can't physically hurt your spouse or your spouse is hurting, so that is also there. Then उसके बाद क्या है डिसोल्यूशन होगा तो नेक्स्ट स्टेज होगा ग्रीफ क्योंकि वो ट्रिगर करेगा like divorce separation. So maybe the person is trying to avoid grief in that he or she is staying in the relationship. So if you help that person grieve, or maybe they are breaking up, getting back together because the person is unable to get over the grief. So the person understands I can't continue with the relationship, starts with the resolution process, and is unable to face it, then goes back. Then again this cycle repeats. So resolution and then help coping with grief. Okay. So all of this is there in this template. It is very beautiful. You identify the area,
Yes,
and then you identify the area, and then you apply the treatment part, and you can. So it is in relationships many times the person himself tries to take side. What actually is happening, so that way you can go ahead.
I think the psychiatrist take out cues from the
Yes.
therapy and then actually apply them in their clinical context, at least briefly.
Yes.
These are very practical things. You go to the next slide. Next. Let that are decision. So
Yes.
in this context, what do you use? Whether you use directive technique or decision analysis. If someone comes to you with extramarital affair, क्या करूं? Whether should I go with my new relationship?
Many times they ask for
They
your
ask
advice.
क्या करें? If you say go with a new relationship, then husband को पता चल गया वो आपके पीछे आ गया. And you say don't go to relationship, patient will not go. Patient ने हमारी मन की बात बताई नहीं. So whether then directive technique will work there because patient is not able to take the decision. So maybe in this context, initially we will use decision analysis. We'll show the patient, discuss the patient and actually give them the options. Later on, maybe after few sessions, then we can use this directive techniques. And it is a very common scenario, common if the patient has confidentiality, the patient is confident, patient will share these issues.
So yes, that is you're not supposed to take decisions for the patient. Don't say that okay, in my opinion,
Yes.
they at times come to you and they would want you to psychoanalyze their spouse. What do you think? Will he change? Will she change? What about their behavior? Should I continue? How do you think from my behavior? Will I be able to cope with this? So you have to say that this is not my decision. You can advise and suggest, and you can help it with practical problems. Okay, help in solve practical problems. For example, wife is saying my husband doesn't take care of me. Okay, like I have to go shopping, he doesn't come with me. I have to go to say training something and he doesn't go. So you identify that he is the one who's driving her. So you can say, why don't you take up driving? Why don't you try going alone? So these kind of suggestions you can make, which maybe the patient has not thought of. Okay, but decide that okay, from now on you go and not drive. So okay, so you can suggest. But for major life decisions, it is for the patient to take. You can suggest.
By saying
so there you can say, okay, You see any patient in those rolled 4 areas that we can decide. Come back to that first slide. Yes. 3 role transition. Actually, if you see for most of the patients, you will find some problems. Okay. Role disputes. Role dispute is like they are like what the other person should do. For example, if the person is disturbed, then expect that the other person should help understand. ये मेरी बात नहीं सुनते, मेरी बात नहीं सुनते, ये एक problem. That is the problem. So, a wife taking the job. Okay. Now there is a change, role transition. Role dispute is who will do the work, but she was doing. Okay. So the wife now thinks that the husband should also pitch in for the some more work. And the husband thinks that I never asked her like to do the job. We are financially okay. Why should you are doing it for yourself? It's like you're not even earning that much. So that is a role dispute. Like he wants her to remain as a housewife. She wants to become a homemaker. So her role is switched from a homemaker. She's taking them that now I should get a job also. So that kind of a change is there. And then there is a dispute.
Even dispute can be like 2 brothers, 1 brother is married, second brother marriage has happened. A new member in the family, now there are disputes between the wives. And then कौन कितना करेगा, कैसे करेगा, specifically one of them is homemaker and one of them is working.
Yes. So that's why they expect that the work working will also contribute equally. And they say they know that she's at home, so she should do more. So then again there is
Very common to our society.
marriages, new relationships. You know, what is the role of a, like this is a very common problem. What is the role of a person? Okay, whether that person should do what work at home. She has a defined, he or she has defined work like this is my, so as a, say for example, for a men, it is my role, I'll go outside, do outside work, work the काम करूँगा, don't
Transition means a working wife. No, getting pregnant, delivering a baby, and then now becomes she mother. Then there is a transition. There is a negative and positive, and then that will welcome to depression.
very common. Like she's saying all the time to the child. Okay. The spouse thinks that she should continue with that old role that she was earlier before marriage. So there's a conflict. On the other hand, it can be vice versa also that the mother thinks that now I'm considered, I'm not considered as a wife. I'm not considered like they go together, they will take me and don't include me as they used to earlier. So that
And these are not isolated categories.
yes,
Transition will bring dispute, and then it will bring deficits.
you will always find a combination of usually find combination of
Very interesting. Everyone is supposed to read it to help you all in actually dealing with very subtle problems with patients. Not doing a structured therapy, if not possible, at least read it. That is very important.
Sir, and
deficits are lacking, like somebody is lacking in, say, there is lack of social activity or it's impulsivity. So there are some things are lacking in that person. Neither in job, interpersonal deficits. Okay. So yeah, communication skills are lacking. So there are a string of, you can say, failed relationships that happen over like because of the something that a person is not able to do. So here it is a little bit more than that. There are some social phobias like that or problem with communication. So that is there.
You were patient against wife आपकी उसको लेके ये तो बोलते हैं
होते हैं.
तो सीधे सिस्टम सब प्रॉपर्टी के पीछे पड़ा है ये मतलब they will actually point fingers at the ये तो बोलते हैं all these things
Sir, many patients also, sir, their depression aspect. Family members has poor insight regarding
depression in that context, or husband is in depression in that context.
family members also thinking that depression is like a acute disorder. It's not a chronic one. It's not a disability. Due to these issues, डिप्रेशन मतलब पेशेंट फैमिली मेंबर्स क्या समझा रहा है मुझे इनको उदासीपन होता है बस मतलब सेल्फ एस्टीम के बारे में उनको नहीं पता है और उनको नेचर मतलब पेसिमिस्टिक नेचर के पेशेंट के बारे में नहीं पता है इस वजह से ये ऐसे कर रहा है the lack of insight develops like interpersonal disputes also.
One of the percent about it is for the patient. Okay. Many times the patient will say that you talk to my husband also, you talk to me. So it is targeted towards the individual, how he tackles his social relations. Okay. It is not couple counseling. Like they will interpersonal piece of people that okay, why both should count both. So interpersonal therapy is not primarily couple counseling. It is for the patient. You teach him how to hope you identify the problem areas. And there may be areas where you may have to take, you can say, other person who also count also trying to help the patient. Primarily it is for the patient. So all the people are directed towards patient. How he deals with it. Assertive therapy, like you teach him to say no to things that he or she is giving into. Okay, trying to not adapt to the old road or basically it is for
Leave is also not death.
yes, it's not
a loss of a relationship. So can break up.
Yes.
Loss of relationship.
Break up, somebody moving away. So relationship, external relationship per se is not there, but what it will lead to conflicts. It will lead to conflicts that are where you may need to find out whether there are some interpersonal deficits that a person has, past behavior, identify whether there was some problems that the person was facing because of that. So one event is not a body, but it leads to
so that all these issues, loss of loved one, death of spouse, something, the family, external, they're leading to conflicts in interpersonal domains across these 4 areas. Usi ko bhi, when those are not resolved, person goes into depression. Or when they are resolved, person comes out of depression. This is the whole construct of and very important. See a lot of patients very complicated. So in a treatment plan, you should only say this. If you find these are areas where problem is there, then you have to put in your treatment plan. I hope I can. Generally, examiners will appreciate that.
specifically what will you do? What you will do? What will you be?
How many phases, what you will do, what are the approaches, directive approach, decision making, all these things.
Interesting topic. One of the 4 areas of therapy that you should know, you should be aware of. Or your daily practice. One uses by you both of them have this role dispute and although we are really anti-Christians, both of them, but then again, part of this is a fair bit Israel's part of listening and that what advantages and objects you might have. Both of them had this problem which partners by both. Suppose this had there was this 2 or 3 partners and although there were personality issues also, but then again, part of the complaints were resolved with this unstructured check. So this obviously had there no therapy, they're feeling totally at loss. The efficacy of this therapy are like take it at hand. Seems like that okay, is a long one, but still within 20-25 days also, some part of the of this 5 days. Even doing the therapy, very important area with your pharmaceutical sense of different
I think more interesting to add some videos because watching therapy is kind of a more than to discuss how they are doing it. And for everybody who's interested, I like to suggest a very good series or in treatment. This series here, and it is a very good. I mean, they have done a lot of research for meditation. So the series is how this is done because basically only about therapy and about personal life. Mostly it's been interpersonal therapy only. It's a wonderful series and वो देखने में तो आपको बहुत अच्छा idea है how this actually done.
Thank you.
I think you presented well. Better than last few presentations. We could together, you were improvising, you were presenting more in hold of what you wrote and you produced. That context it was well minus those last few slides. You would have actually put it in 2 lines. Evidence, reference, and that approach. Other than that, I think I agree that some examples would make things more easy to comprehend.
very nice illustration. And I think that case in the scenario are important. If you have yourself consistent in the application, so if you have got the topic in advance, you can that way make it more interesting. It's very wide topic, and we can in fact take a seminar on each of the 4 areas. So that is there. Otherwise, it was overall very good.
Which I will do, sir. I will ask.
Getting an academics like this becomes a very good learning. Yes, you could learn much more than what we sit and hear.
Yes.
I shall not miss.
Please.
Thank you.
तो तुम्हारा हो गया ठीक है ये जरूर करता 1000 कट करूंगा सर तुम्हारा पेमेंट है